for the best medical and paramedical lectures. Subscribe to our channel and press the bell icon to stay connected with us.
Hello everyone, today's topic is misconceptions about mental illness. Before starting the lecture, please subscribe to our channel. Let's begin. This is developed to dismiss the misconceptions about mental illness. This is a strategy to educate about mental illness and reduce stigma against mental illness. Mental illness is just like physical illness. Moreover, it's an illness no matter if it's mental or physical, it's an illness. So we should try to understand the person who is going through that phase and support them instead of judging and hating them. Beliefs about mental illness have been characterized by superstition, ignorance, and fear. Although time and advances in scientific understanding of mental illness have dispelled many false ideas, there remain a number of popular misconceptions. Some of them are: mental illness is caused by supernatural power and is the result of a curse or possession by evil spirit. Many people do not consider mental illness as an illness, but possession by spirits or curse that has befallen on the patient or family because of past sins or mistakes in previous life. Mentally ill people show bizarre behavior. Patients in mental hospitals and clinics are often picturized as a weird lot who spends their time exhibiting useless bizarre behavior like twisting of heads, etc. Mentally ill people are dangerous. People who have or had a mental illness are viewed with suspicion and a dangerous person. Mental illness is something to be ashamed of. This idea arouses an unsympathetic, cruel attitude towards a mentally ill person. This is the reason why many people hide their illness in the family. Mental illness is not curable. People object to have a normal relationship with mentally ill people or to give them employment even after being cured, or even to accept them as neighbors. Mental illness is contagious. The fear that it is contagious is the main false notion which leads people to view suspiciously or to object to marital relations with a person belonging to the household of the mentally ill. Mental illness is hereditary. It is not a rule that children of mentally ill patients should become mentally ill. Marriage can cure mental illness. A mentally ill patient can get worse if he gets married when he is ill, as marriage can become an additional stress. A patient who has recovered can get married and live a normal life like any other person. Mental hospitals are places where only dangerous mentally ill individuals are treated, and restraint is a major form of treatment. People hesitate to take their relatives to mental hospitals for treatment because of fear. Further, as an ex-patient of a mental hospital, he as well as his family members, people seek help from mental hospitals only as a last resort. Myths and realities. The myths are that mental illnesses aren't real illnesses. Mental illness is caused by the usual stress of everyday life. It's caused by poor mothering, but in reality, mental illnesses are caused by alterations in thinking, mood, or behavior. Everyday life stresses are normal and necessary for learning and developing the life skills. They do not cause mental illnesses. For some people, severe and persistent stress, like living in a war zone, increases the risk for developing a mental illness. Mothers have always been blamed for many things. Poor mothering may not help children grow and develop well, but it by itself does not cause mental illness. The myth is that mental illnesses are caused by food that we commonly eat as the result of a moral failure or laziness. But in reality, rare vitamin deficiencies such as thiamine B12 can be associated with some symptoms found in some mental illnesses, but foods we eat do not cause mental illness. The myths are that mental illnesses are caused by witchcraft, spells, or possession by demons, and mental illnesses are the result of punishment by a higher power, such as God or karma. But in reality, mental illnesses are the result of disturbances unusual brain function that lead to difficulties with the control of feelings, thinking, and behaviors. Mental illness are not caused by spirits, witches, or demons, and mental illnesses are not the result of punishment from God or bad karma. The myths are that people with a mental illness cannot be good friends and people with a mental illness cannot achieve anything. But in reality, people who have a mental illness can be just as good friend as someone who does not have a mental illness, and sometimes a mental illness can make it difficult for a person to work, same as a physical illness. But with proper treatment, a person with a mental illness can work very well. Some of the world's greatest achievers have had a mental illness. So these are common misconceptions about mental illness in society, like they are violent, they could change if they tried, they did something wrong to become ill, they just want attention, they are faking it, they are burden on society, like that. But there are ways to overcome those misconceptions, like learn about the condition, talk with medical experts, talk about illness with others, be empathetic, sympathetic, and compassionate. General attitude towards the mentally ill. In general, the community responds to the mentally ill through denial, isolation, and rejection. There is also a lack of understanding of mental illness as any other illness, and a lack of tendency to reject both the patients and those who treat them. Mentally ill are viewed as people with no capacity of understanding. People feel mental illness can be cured, and even if the patient gets better, complete physical rest is considered essential. The mentally ill are by and large perceived as aggressive, violent, and dangerous. An individual's values and personal beliefs affect his attitude about mental illness. The mentally ill and treatment of mental illness. There still exists a stigma surrounding individuals who need or use psychiatric mental health services. The need continues for public education to modify or alter misconceptions about mental illness and people with mental disorders. So, bust myths and speak realities. Many people do not know about the realities of mental illness, and so they continue to believe myths. Once you know the realities about mental illnesses, you can help bust myths by letting others know the realities. Everyone can bust myths when they speak realities. So stop stigma and spread awareness. I hope you understood, and thank you for listening.
Do like, leave a comment, and share with your friends.